this segment of the Bridges program. We're here with Beth Heeb. Beth is the Executive Director of the Consumer Health Coalition in the North Shore in downtown Pittsburgh. Beth, if you would, tell us a little bit about the Consumer Health Coalition and how you help people.
Sure. Consumer Health Coalition is a healthcare advocacy organization that seeks to ensure that vulnerable populations have access to quality, affordable health care. And we would define vulnerable populations as those that are at the greatest risk for experiencing disparities in health care. And those would include individuals with disabilities, folks with low incomes, and individuals from various racial and ethnic minority backgrounds. To accomplish our mission, we really focus on three primary areas: direct service, education, and advocacy. Under our direct service programs, we operate a helpline for the uninsured and underinsured. And by underinsured, I mean individuals may have health insurance, but for some reason it doesn't cover a test or a prescription that they need. So individuals can call us and work one-on-one with our staff to go through a brief assessment to see if they're eligible for various different types of public health services, and in some cases, public health insurance. If an individual does qualify and they're interested, we will walk them through step-by-step the application process, as well as help them submit the applications, and then follow up to make sure that they receive the services they applied for. As far as our education is concerned, we do educate both consumers and organizations. Our consumer education is really focused on empowering individuals to really be proactive in their health care. So we offer what we call proactive patient workshops. And during the workshops, consumers learn how to interact with their physician, what to bring with them to medical appointments, and just in general how to really play an active role in their health care and how to manage their illness on their own. We also do provide general advocacy workshops for consumers so that they can, know what it means to be an advocate and how they can participate in broader system reform through our public policy advocacy that we do. For organizations, we do educate them on the services available through our helpline. So in the event that someone comes into their office and is in need of a service, they know that they can refer them to us for assistance. And then we also do educate them on pertinent public health policies that would in fact impact the clients that they serve. And finally, the advocacy work that we do. Consumer Health Coalition was really established to make sure that there is a consumer voice in healthcare at all the decision-making tables. So what that means for us is we will voice our opinion, both positive in favor of and negatively if we're opposed to various health policies that are being proposed, changes to existing policies, as well as offer opinions on policies that we think need to be enacted.
Wow, that's really great. So you're not only working, with the individuals, but you're also educating them, and you're also working as an advocate for them to work with the health insurance companies to make sure they get taken care of also.
Yes, and we do that primarily through, we work exclusively, I should say, with public health insurance programs. Okay. But yes, we can help with a number of things from assistance with charity care, discount medications or medical device at discount, as well as enroll in public health insurance programs.
Wow, that's great. That's great. Now, for people that are actually coming to the Bridges website and they want to help support the Consumer Health Coalition, what can they do to help you?
Sure. So Consumer Health Coalition is always looking for volunteers. We accept volunteers to help receive calls to our helpline, as well as to assist with some of our educational programs, specifically those with adults with disabilities. And we also are looking for volunteers for various different board committees, one of which would be the fundraising committee to volunteer to help at events, or serve on the committee if they, have different suggestions on types of events that they've seen elsewhere that they want to help Consumer Health Coalition to establish. That would be great. And then, in addition to volunteering your time, we are a membership organization, so we do have memberships available for both individuals and organizations at various different levels. So one could either become a member on behalf of their organization or an individual. And then, like all nonprofits, we do accept financial contributions. If someone has the ability to do that, we would graciously accept it.
Okay, that's great. Beth, thank you very much for coming out to the Bridges program.
Thank you.
For anybody who is watching this interview, if you would like to go to the Consumer Health Coalition's website, consumerhealthcoalition.org, I'm sure they have some wonderful information
Yes.
and be able to tell you a little bit more about your organization.
Thank you so much. I appreciate it.
Thank you for joining us.